Good evening again, all, and welcome to Spotlight Endometriosis. I am glad that you are here with us tonight, I should say. And I am so happy. I actually missed you guys last month. So I'm glad we were able to jumpstart it again for the month of October. I want to apologize for starting late, technical difficulties, work-related issues, but we are here and we're going to have a fantabulous time. I want to, of course, acknowledge our executive members and board members from the TTEA who are here with us. Thank you for making it this evening. I also want to acknowledge our guest, Dr. Alleyne. She's here. Her camera just went on a little bit. I don't know if she wants to put it on again just for us to see who she is. And there she is. Hey. So you know me, I like to jump right into it because I know sometimes the questions keep coming and I don't want us to have to end the meeting too soon without giving persons an opportunity to ask all the questions they want to ask, right? So I just want to read the disclaimer and remind persons that the information shared on this program is for general, informational, and educational purposes only. It does not constitute professional medical advice, diagnosis, or treatment for individuals. We advise you to please consult your healthcare provider if you have questions about your health or before starting any treatment, right? So let me introduce Dr. Verne Alleyne for you. She has been a physiotherapist for over 28 years. In 1994, she received a diploma in physical therapy from the University Hospital of the West Indies, based in Mona, Jamaica. In 2000, she earned a Master of Health Science degree from the University of Indianapolis in the United States. In 2003, she received a certificate in healthcare management from Indiana University. And in 2007, she received a Doctor of Physical Therapy degree from the University of Indianapolis. Dr. Alleyne holds other certifications, amongst them in spinal manipulation, dry needling, and pedorthics. I hope I pronounced that correctly. She is a certified lifestyle disease practitioner and is an American board certified wound specialist. Dr. Alleyne is the managing director of Excel Physiotherapy, where she provides service for all types of patients, including athletes at all levels. She also works part-time with the Tobago Regional Health Authority as the wound care coordinator at the Scarborough Health Center in Bacalet, where she provides evaluation and management for patients with chronic and hard-to-heal wounds to prevent amputations. She was a former director of physical therapy at Huron Medical Center in Michigan and Decatur County Memorial Hospital in Greensburg, Indiana. Dr. Alleyne volunteers with the National Association of Athletics Administration and the Trinidad and Tobago Olympic Committee as part of their medical team. She has attended several regional and world championships in sporting events, including the Olympic Games and the IAAF Track and Field World Championships. She just returned from the recently concluded Commonwealth Games in Birmingham, England. And she has added her motto, which is whatever you do, give it your best. And with that, Dr. Alleyne, I know you're going to give your best. So please, round of applause for Dr. Verne Alleyne. Thank you, thank you.
Well, thank you, everyone. Thank you for having me as your guest. I really appreciate the opportunity to talk to you or talk with you and have a discussion about endometriosis. I have to apologize, though. I am in my office in Goodwood and there is carnival going on in Tobago this weekend.
I just landed from Tobago, so I know. I was in the midst of that with work, I know.
So let me apologize because you may get some music trucks passing by. So let me apologize for that happening. So if you can't hear me, just please let me know so I can respond appropriately. So tonight, what I really want to do is you know, just to have more of a discussion than a lecture, because what I want to do is really put a very almost practical or lifestyle approach to managing endometriosis. I don't know if Kimari told you, but I am also an endometriosis survivor. So I can speak the language. I have walked the journey. I have been there, done that with endometriosis, and I know it's really not a great pleasant disease to have as a woman. So I do know how the struggles. I really do. So so we'll just get right into endometriosis, and I guess everybody in this forum, or most people in the forum, will be familiar with what it is, which is really a chronic pelvic pain, and it has several manifestations. But besides being a chronic pelvic pain, it's not really easily understood. It's not understood. It's complex. And for the most part, we don't know what causes endometriosis. Does anybody have any idea, any straightforward answer as to what causes endometriosis? And I'm very open to answers. But what we know for sure, it's not easily diagnosed. And I remember with my journey, especially in my 20s, that's when I had most of my symptoms. A music truck is passing. Are you guys hearing me? I'm just checking in to see if you're hearing me or you're hearing more of the truck.
We're hearing you clearly, doctor.
You're hearing me? Okay, great.
Yes.
All right, so we know it's not easily diagnosed because the symptoms vary from woman to woman. Some people have chronic pelvic pain or the feeling as though they're having a period all the time. Some people just have painful intercourse or sometimes bleeding after intercourse. Some people are just psychologically distressed because of the prolonged bleeding and the pain and everything else that goes along with it. Some people have bladder and bowel issues. Some people's uterus sometimes get fused onto the rectum because of the endometriosis adhesion, causing serious bowel adhesion and bowel obstruction. Some people can sometimes even have lung obstruction or lung disease or lung related function because the endometriosis, the endometrial tissue can migrate outside of your uterine system. And typically there is no cure or no known cure for it. And the best shot is at managing the symptoms, which is usually the pain, discomfort, and the stress that goes along with it, as well as for some people, surgical intervention. And in my case, I had 2 surgeries for endometriosis. And so, and as for the people who have had it for a long time, we know that the lesions can grow back from time to time. So if you have a surgery in your 20s for endometriosis, there is a high possibility that in your 30s, 40s, you can have another surgery again because the lesions can grow. Again, the cause, we don't know for sure. Genetics, environmental, complex hormonal factors, environmental toxins, retrograde menstruation. Even the brightest minds, as far as I know, don't really know the cause for this potentially devastating condition. In lifestyle medicine, for those of you who are not familiar with lifestyle medicine, it's an evidence-based practice of assisting individuals and their families to adopt and sustain behaviors that can improve your health, your general health and quality of life. And usually lifestyle medicine comes in for people with diabetes, high blood pressure, high cholesterol, obesity. That's where lifestyle medicine comes in. But for persons with pain, for people or sufferers of endometriosis, it is really not a stretch to consider lifestyle medicine as part of the ammunition that you can have in your back pocket to deal with endometriosis. And I hope you guys are still hearing me.
Yes, we can still hear you.
You can still hear me, okay, because the music is turning up in the background there. So with lifestyle medicine, there are basically 6 pillars. The 6 pillars of lifestyle medicine, which can be embraced to manage endometriosis, are sleep. The 6 pillars: sleep, exercise and physical activity. And I like to say exercise and physical activity because a lot of people confuse exercise with physical activity. And while there are similarities, they are not necessarily the same thing. So physical activity is classified as the things that you do in your normal everyday life to function, like the extra steps you will take, or going up and down your stairs to get in and out of the house, or to work, or to get anything done around the house, your household activities, your gardening, stuff like that is considered physical activity. However, exercise is a conscious, repetitive movement that is designed to increase muscle strength or increase cardiovascular endurance. So you don't necessarily get increased cardiovascular endurance and strength with physical activity, but in order to get increased strength and cardiovascular endurance, you must exercise and do repetitive work. All right. So the other lifestyle medicine or lifestyle approaches is community and healthy relationship. So going to church, having support groups like your endometriosis support groups, having healthy relationship, getting rid of toxic people in your life, toxic negative people, narcissistic relationship, or getting rid of narcissistic people out of your life can play a significant part in getting your stress level down and managing your pelvic pain. In terms of stress management, we usually look at things like mindfulness meditation, or walking, just walking. Or there is something the Japanese now called forest bathing, or walking in the forest, or just spending some quiet time by yourself. Things like these could help in management of stress. And of course, I'm going to talk about diet and nutrition a little further down, because that's also important. And there is some evidence to suggest that diet and nutrition can play a major part in managing endometriosis. Another significant part, or another critical part of lifestyle medicine, is avoiding dangerous and risky behaviors. Things like smoking, drinking, and addictive behaviors that could have an adverse effect on your health, and in turn help to increase your pain. So sleep. So I'm just gonna take apart sleep for a while. So for those of you who don't know, your cell phones is not your best friend at night. The TV in your bedroom is not necessarily the best thing if you want to have optimal health. And if you want to improve the quality of your sleep, having a cell phone in your bed or in your bedroom is not a good idea. The blue light that comes from the screen and from the cell phone disrupts your brain function and should be avoided. So sleep is important because lack of proper sleep impairs or affects your bodily function. So if you don't sleep well, your body will not recover from the traumas it goes through during the day. Your brain will not function well because sleeping is required for your brain to regenerate and to cleanse itself. So if you don't get that minimum of 6 hours sleep per night, you are at risk for having pain-related issues as it relates to endometriosis. You are at risk for having other lifestyle diseases such as diabetes and high blood pressure and cardiovascular diseases. The thing is, if you're not sleeping well and you have something like diabetes in addition to endometriosis, it can potentially make endometriosis worse because diabetes is an inflammatory condition in the body, and so is endometriosis. So you'll be having a double whammy going on there. So I'm just getting a little distracted by the noise here. So we talked about the sleep affecting the immune function, and it is believed that there is some disruption in the immune function as it relates to endometriosis. There's some school of thoughts that says that there is some compromise in the immune system that can be one of the causes of endometriosis. So we can now begin to see why it is so important to embrace sleeping as a big part of our lifestyle management to managing endometriosis. I'm just going to touch a little bit on sleep hygiene, and this is really big now in the health community and in the lifestyle community, because we recognize that it is so important to get proper sleep at night. And because of the chronic pain that we experience from endometriosis, sometimes getting 6 hours of sleep is a tall order. There were some studies done on women with endometriosis, and they found that there is significant disruption in sleep patterns in women with endometriosis. So therefore, for us as women who are living with endometriosis, we should become sleep evangelists, because it is so important to help to manage our pain symptoms. So our bedroom should be a shrine for sleep. So the TV, the work, the school work, the university work, any kind of work should not be a part of our bedroom settings. So your bedroom should be designated as a place for sleep and sex. And if you find that you're doing anything else outside of that, sleep and sex in the bedroom, then we need to consider looking at cleansing the bedroom to create that shrine for sleep. Another thing we need to do is to consider a sleep routine. So we try to go to bed at the same time. I know for the shift workers, it will be a little bit more difficult, but if we program our brains to go to bed at 10 o'clock or 10:30 at night and wake up at 5 or 5:30, 6 o'clock, then we get our bodies into a routine so that we can maximize our sleep capacity and our sleep ability. The other thing that we have to consider is we need to avoid eating late at night. So if we can cut out eating like 2 hours before bedtime, that would be very helpful for metabolism and also for our restfulness during sleep. And avoiding caffeine 4 to 6 hours before bed. Caffeine and alcohol about 4 to 6 hours before we go to bed in order to put our body in a state of restfulness and not a state of not in a hyper energetic state. So we need to be calm before bed. One of the things that we can also do is find something that you think is amazingly boring and do it before bed. So you don't want to excite yourself before bed. So if, for example, knitting is boring, crocheting is boring, or crossword puzzle, not on the cell phone, on a book, if we could look for things that are boring, or just reading a book sometimes for some people is boring. And remember, if you're reading the book, we're not going to be reading it on our tablets because we don't want the blue light. For persons who are really severely challenged with sleep, if after sleep, laying in bed for 20, 30 minutes and you're not able to get some sleep, you need to get up, go outside, find something to do, and then come back in again. And there's a lot of information on sleep hygiene on the internet. So Howard University is one of those places that have information on sleep hygiene. Physical activity and exercise. I'm a physical therapist, so I'm unapologetically pro physical activity and exercise, simply because endometriosis is potentially, for some people and for most people, an inflammatory condition. And a lot of studies have shown that exercise is anti-inflammatory. So because of that anti-inflammatory effect alone from exercise, we want to be able to do as much of it as we can in order to help to manage the pain. The other thing about exercise is that the exercise activity helps to stimulate endorphin production, which is also a natural pain-killing hormone in our body. So that will help to manage some of the pain with endometriosis. Although some persons will tell you that there is no difference with whether or not they exercise. So this is something in along with your doctor that you will have to see or work with to see if it would work for you. But definitely exercise and physical activity has been shown to help to reduce pain or modulate pain for some people. The other thing that exercise does for some people, again, it helps to induce sleep or induce a more restful sleep. So if we can help to fix some of the sleeping issues with regular exercise, so we decrease the inflammation with the exercise, and then you can also improve your sleep, then you can also get some additional benefit from improved sleep and decreased inflammation from exercise. So there's a direct effect of exercise, and there is indirect exercise, the effect of exercise for endometriosis. What is the best exercise? I don't know. It's the exercise that you can do based on your symptoms, based on your physical activity, and that exercise that will keep you exercising until that time comes. So you don't want to get into any kind of really, really high intensity exercise 5 or 7 days a week, because continuous or too much high intensity exercises will increase your pain, because it will increase the inflammation in your body. It would increase the cortisol in your body, which is a stress hormone, and that could potentially make your endometriosis worse. So the thing about exercise is that you have to pace yourself. You have to do something that you're comfortable with. So if you can blend like some continuous walking, slow walking, medium pace walking, and 1 or 2 days of high intensity exercise, and a couple of days here and there of resistance training, that will be great. But you don't want to be doing high intensity exercises every single day of the week, nor do you want to be exercising twice a day unless you're a professional athlete, because too much exercise will stress your body and can potentially increase your pain. Diet, nutrition, and supplementation. Of course, I'm not a dietitian, so this is not my area of expertise, but the studies have shown that different types of diet can affect persons with endometriosis. So there are some people who will swear by the Mediterranean diet. There are some people who will tell you a low carb diet helps to manage their pain. Some people will tell you even lower than a low carb is a ketogenic diet. They've used that successfully to manage their pain. Some people will tell you that a gluten-free diet helps to manage their pain. Then we have the vegans, the vegetarians. The thing about diet is it's personal, it's unique to each person, and therefore you just have to see which one works for you, and you work along with your medical provider to select the diet that is most important for you. There are some supplements that have been used with varying outcomes. So there's vitamin D supplementation, there is vitamin A, vitamin C, vitamin E, omega-3 fatty acids, all your fish liver oils. They have been shown to have some effect on persons with endometriosis. Quercetin and B3 have also been shown to have some effect. Turmeric works for some people, whereas other people, they will tell you that it causes increased bleeding. So generally, most supplements that help with inflammation, they tend to have a positive effect on some people. Again, you work with your providers to determine which is best for you, because there is no one size fits all when it comes to supplementation and diet. I just want to go back to avoiding dangerous and risky behaviors. Smoking, drinking, drugs. We have normalized smoking and drinking and marijuana and a lot of recreational drugs. And while the debate is out on whether or not marijuana or CBD works for some people, generally any substance that has the potential to cause addiction, that adversely affects your health, can definitely have a negative impact on endometriosis. So whether it be cigarette smoking, directly or indirectly, that can cause inflammation in your body and cause your pain symptoms to be worse. The same thing goes for other forms of harder drugs like cocaine and other forms of drugs like that can definitely have a negative impact on your body. Same thing for alcohol. Avoid or moderate the consumption of alcohol because it really can adversely affect endometriosis. Then there is the environmental effects the environmental factors that affects endometriosis. Some of you may have heard about xenoestrogen. And xenoestrogens are just artificial form of estrogen. I don't know if I may not have mentioned this earlier, but it is believed that excessive estrogen production in the body is one of the major drivers of endometriosis. And therefore, anything that can potentially tilt that balance of estrogen, to increase the estrogen in your body, has a negative effect on your body. So things like parabens in lotions and shampoos and chemicals used as pesticides, insecticides, some of the estrogen that is fed to our beef and our chicken is detrimental to people like us. And that's why it's always good to try to go organic, grass-fed, or for us, or yard fowls is probably a better thing to consume rather than the imported chickens and beef with all the toxins in them. Some of our disinfecting and cleaning agents also have xenoestrogen. Items that sometimes we use as preservatives for our fruits and vegetables and even our foods. Even some of the dyes that are placed in foods, like some of our breakfast cereals that comes in all the colors of the rainbows, those things are not necessarily healthy for persons suffering with endometriosis. And also there is the debate about the BPA, that chemical that is leached out into the water when we drink water from plastic bottles every day. So might be a good idea to consider using glass bottles instead of plastic bottles. From a dietary perspective, we can increase the consumption of cruciferous vegetables like broccoli and cabbage and kale. We need to pay attention to gut microbiome. So taking a probiotic is really a good idea. Things like increasing your consumption of yogurt, unsweetened yogurt that is, and decreasing sugary foods and snacks is a good idea to help to maintain a good gut microbiome. So I think I have gone through most of the lifestyle ideas that I wanted to touch on. And we know that endometriosis is here to stay once we have it. We can manage the symptoms. We can make the best of the situation that we have. But as far as I know, as far as the research says so far, there is no cure for endometriosis. So at this point, I am open to questions.
Hi, Dr.
Hi.
Yes, so thank you for that. Those 6 pillars, I actually wrote it down, and I'm surprised that, well, I shouldn't be surprised. That sleep is number 1 on the list.
Yes.
And I know for a fact. Let me ask that question one time. So for me, ever since I was younger, I found that if I slept more than 6 hours, I get bad pain, regardless of whether I'm in the midst of an endo episode or not. If I try to sleep longer than 6 hours, I get up very stiff with a lot of pain. No, that doesn't mean I'm not tired. So what I have to do is get up, move around, wait for the sleep to kick back in, and then go back and sleep. Based on my job as well, especially as I worked in Tobago this weekend, I probably have, the first night I went in, I probably had 4 hours sleep and then 12 hours working. So I started working for 12 hours, 4 hours sleep, then another 12. Then I probably got 6 and now I'm still going today. But that is my life. Please,
I understand.
advise.
Well, you know, my best advice is you gotta do what you gotta do to earn the living. But honestly, for your health in general, 4 hours of sleep is for you, even not even just from the endometriosis side of things, but from the general health side of things, 4 hours of sleep is tipping the scale, because your body does not get the time to regenerate and to heal. And your brain, we hear people talking so much about brain function. Your brain starts to purge itself out after about 3 hours of continuous sleeping. And when we don't allow the brain to cleanse itself, then we start having Alzheimer's issues and different types of mental health issues. So I would suggest that if you can't get it 4 straight hours at night, you might have to consider filling in some naps during the day if you can. If you can, but long term, it's really not good for your health.
So then how I try to work it out, I work it out as a math problem. I'm supposed to have 8 hours a night of sleep. So when you had 4, so that means I'm minusing 4. And the next night I had 6, that's minus 2. So I have to make up 6 hours of sleep to add up to my 16 hours, because for 2 days, 8 by 2 is 8 and 8 is 16, right? So that's how I work it out in my brain. And I tell myself, okay, but I can only go for 6. Listen to me, it's a whole mathematical thing for me to try and make back the hours of sleep. But the nap during the day, not in the job I have. I remember going to work one morning in the midst of an endo episode, and I reached the work around 6. A little after 6, I went up in the lounge. My coworker came with a blanket and she just allowed me to sleep until 8 o'clock.
Oh, that was nice.
Yeah, so that was my nap.
You have a good community. That's part of having a good
That's
community.
part of my community, correct.
Very, very important. Yeah, very important.
I see someone put sleep as a surprise for my spouse and I, and it's something that we are going to implement. Quality sleep is a priority from now on.
Yes, yes, it is.
It is.
And
Now, go ahead.
I see the question about pelvic floor
exercise,
but
yes. No, that's the question I was going to ask with the pelvic floor exercises.
Yes, actually, yes, because of the chronic pain in the pelvic area, anytime there is pain in a muscle, it shuts down the muscle function. For example, if you have pain in your leg, then chances are the muscles in your leg wouldn't be moving as well, your knee wouldn't be bending, so you can end up having chronic pain issue as a result of the muscle not being used. So therefore, pelvic floor exercises will definitely be a plus for someone with endometriosis, because the presence of the chronic pain will stop the pelvic floor muscles from having their normal function. So sometimes when some people have incontinence as a result of endometriosis, and pelvic floor exercises or pelvic floor rehab is actually one of the tools that is used in physical therapy for the management of pain from endometriosis.
Let me ask a question. Right. So the person who asked is one of the men that is a member of our support group. Do you advise, as a follow-on to that question, that our spouses or our partners be a part of that pelvic floor exercise routine? No.
Of course. Of course they can. Of course they can assist, because it's muscle contraction. It's really using your brain and using different postures to contract the muscle. And if you are able to strengthen your pelvic floor muscles, it will make sex even more satisfying. You will be able to relax more with your partner. So you're building your intimacy in the process of engaging your partner with your pelvic floor activity. They can actually facilitate in the process, because sometimes they use weights or resistance as part of the retraining of the pelvic floor. And so your partner can use his finger to help to stimulate or to help to stimulate the contraction of the internal pelvic floor muscles. So definitely.
Okay. Another question, can acupuncture assist as a form of pain management?
Yes, definitely. Both acupuncture and dry needling can work as one of the tools for pain management. Acupuncture is usually performed by an acupuncturist. Dry needling can be performed by a physical therapist trained in pelvic floor or trained in dry needling for what area of pain the person is presenting with. So definitely, yes.
Now, the follow-up question is what is actually dry needling and its benefits? Now, I know acupuncture, you're putting these very fine needles into the part, and I think like they do like a vibration. I hated it. I'm gonna tell you, not gonna lie. I tried it for the endo, hated it. So how is dry needling different from acupuncture? What does it entail and what are the benefits?
Okay, so dry needling is the use of the same acupuncture needle. So it's the same fine needles that they use in dry needling, acupuncture. The difference is acupuncture, like I said, is provided by someone who is a trained acupuncturist. And so an acupuncturist can put needles into certain points, let's say to help you with smoking, or to help you with stress management, or to help you with some gallbladder symptoms. And so with the acupuncture approach is you have lines along your body called meridians. And then on each meridian, there are certain points that are associated with different pathology or different problems with your body. So depending on what you want, which part of your body you're going to treat, you put the needle into those special points. Okay. Dry needling, however, is different. Dry needling is mostly focused on muscle. So if you have back pain, neck pain, an injury to a sports injury, you want to relax the muscle, you want to activate a muscle, you can use dry needling to help to facilitate that. It is not as comprehensive as acupuncture. However, it is to stimulate a local response. It helps to manage pain. And yes, we can, if you're trained in pelvic acupuncture, you can use it to manage endometriosis, or a pelvic dry needling, you can use it to manage endometriosis. I am not trained in pelvic dry needling, so I will not try it. I have an idea, but I wouldn't do it unless I'm trained. But you can use the needles to help to relax the muscle and or stimulate the muscle depending on what you want, or to promote healing.
Okay. Before I ask the other question in the chat, now I hear of persons using cupping, where they use these suction cups and they apply heat. Would you suggest that being used for an endo patient?
Well, because the endometriosis patient presents so, I mean, there is no one way that an endometriosis patient presents. So some people may present with back pain, you know, some people may just have the pelvic pain, the pain in the pelvic region, but some people, it comes along with back pain and leg pain. So cupping may help in that regard. If you have, let's say, lower abdominal spasm that might be contributing to the pain, yes, it may help. So it really does depend on the individual and their presentation.
Right, yeah. So one person has asked, can endometriosis lead to cervical cancer or any type of cancer?
That's a very good question, and it's also a very loaded question. And the answer is, I don't think they're sure. You can have endometrial cancer. Is it from endometriosis? No, I don't think that I've seen enough in the literature that says it can lead to definitely not cervical cancer. Cervical cancer usually comes from human papillomavirus. But can it lead to cancer? There may be a correlation, but not necessarily a cause.
A causation, right.
Yeah, it may not be the cause of it, because there are many women out there with endometriosis, and all of us don't come down with some kind of uterine cancer. So it may be an association rather than a causation.
Right, okay. Now you spoke about stress management. Would you be able to like give us some examples on how an endo patient can manage their stress?
Sure. Meditation, having positive support around you, having a community of people that gives you that positive feel-good feeling that helps to manage stress. I love, the Japanese call it forest bathing, but just walking in the forest, you know, having pets for those who are not allergic to pets, because endometriosis sufferers are known allergy sufferers too. So if you can have a pet, you hug and you play with your pet. You just, like I said, mindfulness, meditation, but all the other rules you follow for stress management. You go to church if that's a place for you to find peace and quiet. Sunlight on your skin, anything that reduces your level of cortisol. Sometimes it means quitting your job, finding a new one, cutting down the number of hours that you work in order to bring some calm to your spirit. And just trying to have a positive outlook on life and to send out some really good positive vibes. Because if you find yourself grumpy every day, that's a stressful place to live in. Right. If you find that you're cussing people all the time and people constantly making you upset, that's a stressful place to live in. So you have to review your own self to see if your attitude, your spirit, your being is causing some of your own problems. So we have to critically look at ourselves and shed some of those burdens that we carry. And sometimes it means walking away and picking your battles in order to manage stress. So, stress management is pretty global.
And I must agree with you with the pet, because I remember, and I'm sitting down thinking about it, and I realized when I had my dog before I got married, she would come up, like she always knew when it was that time, and she would just come and sit by my feet and by my toes, just rubbing in her fur. Just doing that was enough. Or if I'm lying down and she comes by the bed and she puts her head underneath my arm for me to just do this, just lying down in pain and doing that, eventually it calmed me enough to fall asleep. And I didn't realize that was stress management.
Oh, yes, it is. Yes, stroking your dog or the cats. Yeah, you sit there because you cannot, you know what? You cannot be upset and gently stroke your dog at the same time.
Correct.
That's impossible. So you have to calm down.
Correct. So I need a dog. That, in essence, I need a dog. One person asked, do you have any advice on herbal treatment? I know you spoke about the CBD, but herbal treatment.
My advice is not expert advice. So I would rather that you take that to a herbalist and I tell you from my own experience with endometriosis, I have tried several herbs. And personally, I find that some of them made me bleed more. Right. So there are a couple of herbs out there that the herbalist or whoever will tell you, use this and use that, and you tried it and the floodgates came down. So I'm very cautious with herbs and endometriosis because some people swear by turmeric and some people will tell you, oh no, I can't use turmeric. It makes me bloated. It makes me gassy. It makes me bleed more. You know, so it's really up to your research. And when you do your research on the herbs for endometriosis, the Vitex is one of those that they recommend. I personally can't use it because it makes me bleed a lot. So it really is up to you, your herbalist, and what you try and see how that goes. That's my best advice. It's individualized.
Correct. And that is something we keep reminding persons that what may work for me may not work for you, and what works for another person may not work for the fourth person. Yes. Or it may be the same thing working, but in different doses and mixed with something else. But again, we all have to find, each person has to find what works for them, because we have to consider our body types and, yeah. I see one person said that chamomile tea actually helps her with her pain. So that works for her. And
it's also good for sleep. And it also helps some people to sleep.
Correct.
Really, really, really powerful pain. Sleep aid for some people. And some people, it doesn't faze them at all. Yeah.
Now, for me, as you said, chamomile, for me, certain scents actually relaxes me. I do not know that's part of the lifestyle.
Yes.
But there are certain scents that once I'm in the throes of endo pain, once I get that scent, it probably because it triggers certain calming memories, and I start to relax, and I eventually can fall asleep. And then to the other scents, when I smell it throws me off. Yeah, and it's like, yeah, and it affects the pain. Now that I'm thinking about it, yeah, it really doesn't. So I have to be mindful of the scents I have in my home as
Yes.
well during certain times. Yeah.
Yes. Even with your laundry soaps and your laundry
Yes.
detergent. Essential oil is a good thing to try. So when you find out which essential oil works for you, and some of them work for a time, and then after a while, then they start
Yes.
irritating you too. So that's a good addition to your cleaning agents, because if we're looking out for the xenoestrogen, we want to minimize as much of the environmental toxins that come in some of those cleaning agents. So somebody with using vinegar with an essential oil like lavender or something that really calms you down, that could potentially help you. Or lemongrass is another one that can have some calming effect. So things like that, but you have to do your research and find out what works for you.
Correct. I am not seeing any more questions in the chat. I don't have any more questions to add. But I want to thank you, Dr. Alleyne. It's how we were talking, and I'm realizing certain things that I was doing was actually helping. And as I said, I'm not sure if I want to try the dry needling. The acupuncture kind of really turned me off.
That's okay. And that's okay. And that's okay.
Someone is asking about marijuana tea. So Jervin, just like doctor said, the chamomile works for one person. Marijuana tea may help for somebody else. We don't know. So we all have to try different things to see what will help us manage the pain. Now, I hate tea, so I will never, ever try a tea, right? But lavender calms me. I have my plug-in behind me, and yeah, lavender really calms me down. For somebody else drinking it, as she said, the chamomile, somebody will mix chamomile with a little bit of ginger, probably turmeric, and that helps them as well. So I hate to use it, but it's
what's up with the sleep?
Correct. So it could be, we have to become like guinea pigs. We gotta be guinea pigs to figure out what works for us, unfortunately. Yeah.
And we are our best advocate. But the one thing I can tell you about lifestyle disease is that we don't, more than anything else and any time else, we don't want to, because the pain of endometriosis is so severe and so crippling and so disabling for some people. We just can't afford to get a lifestyle disease like diabetes, like high blood pressure, like heart disease on top of endometriosis. So we have to try to pull from all our sources and use our exercise and our diets and try to cut back on the sugars, because sugar is one of the biggest inflammatory agents, that one of the most common inflammatory foods that we eat. So we need to really look at the sugar consumption, look at the high carbohydrate meals that we're having, because at the end of the day, the carbohydrates break down into sugar. So we can't be loading up on so much sugar with something as inflammatory as endometriosis already happening in our bodies.
Right, yeah, definitely. Still no more questions. So Dr. Alleyne, I want to thank you for taking the time to share the 6 pillars of lifestyle medicine. Let me see if I have it correct. Sleep being number 1. So after this meeting, I need to hurry up, prepare for bed, turn off my phone, put on my lavender in my room, and calm down to go to sleep to get 8 hours. You said exercise and physical activity. Your community, your tribe, what I call my tribe, you know, have healthy relationships, persons that understand when you're like this, is to leave you alone because you're going through it, and they do things to keep you at calm. You spoke about stress management, diet and nutrition, and then avoiding risky behaviors. And I think, yeah, it's something that we all must consider because, again, treatment of endometriosis, it's so complex that the treatment must be as complex, you know, just for us to have a fairly good quality of life, you know. And I really, really thank you for this. I have to go home and, well, figure out how I'm going to incorporate all these things. I have at least 3 out of the 6. Stress management, I don't know, that might be go down to number 6 for me to learn to do, but we have to do it. We have to do it. So thank you again, Dr. Alleyne, for gracing us with your presence. Thank you, thank you, thank you. To the rest of our participants, we thank you again for coming in. It's because of you we continue doing what we have to do. I can tell you next month we are going to look at nutrition, and our nutritionist Fadwa is coming with a presentation. I know she's coming to tell me don't eat chocolate. She might tell me I might pass with the dark chocolate, but that is a battle Fadwa and I will continue to have because, you know, I need my chocolate once in a while. But Fadwa is going to come with things we can consider, how we can change our diet, the things we need to have in our diet to help reduce the inflammation when it comes to endometriosis. So I am actually looking forward to that presentation. Fadwa, I have put the pressure on you for next month, right? Thank you again to everyone for coming out. It's 8:08 p.m. and I want you all to continue to be safe. Dr. Alleyne, I know it's carnival in Tobago. For those of you in Tobago like Kimmery, you guys continue to be safe. Try to get off the roads because it's madness on the roads. I just came from there, so I know Tobago may sink with the number of persons who are coming across, who are going across, you know, but enjoy it as much as you can. So from here, pressure accepted. Fadwa has accepted the challenge. So next month, Dr. Alleyne, you need to come prepared with your questions for Fadwa as well. Right, so everyone have a good evening. Continue to be safe and good night. See you next month. Bye.